As mentioned, we have got an interview now with Tara, Debbie and Linda, who will be talking about HS and HS Awareness Week. Good morning, ladies.
Good morning.
Okay, so just to let you know who we've got on, we've got Tara Burton, who is the founder of the... Tara, you're going to have to say it.
It's the Hidradenitis Suppurativa Trust.
Brilliant, and you've been living with HS since you've been 14.
That's correct.
Debbie Brown, who is a clinical nurse specialist in medical dermatology. Yeah, is that correct?
Yes, that's correct.
And Linda, you've also been living with HS for 40 years.
That's right, yes.
Okay, it's brilliant to have you all here, and as it is HS Awareness Week from the 6th to the 12th of June, and you're trying to raise awareness of the condition. So should we start with you, Tara? So can you, thank you for joining us.
My pleasure.
Start telling us a little bit about HS and what it is.
Yes, sure. HS, as I mentioned before, is short for Hidradenitis Suppurativa. It's a skin disease that manifests itself in boil-like lesions that very rarely heal over, so patients are often left with open wounds. These lesions commonly affect the warm areas such as the armpits, under the breast, the groin, the pubic region and the inner thighs. However, it can manifest itself in other places. These lesions cause extreme intense pain to patients on a continuous daily level that very rarely subsides. There is little known treatment or pathways for patients, and they find extreme difficulty in just being able to speak to people who understand what the patients are going through. And often because the disease can be hidden via clothing and patients generally look well, that it's so deceiving, which often leads patients to lead a life of complete isolation and where they are just so alone. It's really saddening, actually.
Yeah, I've been reading over the past few days about it, just to find out a little bit more, and it really does look incredibly painful. Debbie, obviously, you as a clinical nurse specialising in dermatology, you've come across many people who have HS. Can you just? We've talked about symptoms a little bit, but what as a nurse, what are you likely to see when people come in and say that they've got HS? What are they likely to talk about, and their pain and their symptoms and things like that?
Well, a lot of our patients come in and they don't realize they have HS, simply because this condition has a very insidious beginning, and it often mimics other diseases such as acne, boils, abscesses, or other skin infections. We're very lucky in our clinic that we are able to put a name to the condition, which is gives patients finally validation that what they're going through does have a specific name, instead of being pushed from pillar to post with various diagnoses or no diagnosis.
Yeah, of course. Yeah. Well, you saying about that and about how long that can last for, that undiagnosed period of time.
Well, the average length of time to diagnosis is around about 8 years.
See, that's such a long time. It's that period of unknowing, I imagine, as well, because after you've been pushed from pillar to post. Linda, if you don't mind coming in here as well.
Sure.
I'm just reading a little bit about you. It was 15 years before you were diagnosed.
Yeah, well, I was treated for acne for about 10 years before I got my actual diagnosis about 28 years ago. And I was given all sorts of different antibiotics to try and clear what they said was severe acne. So that's what I thought I had for 10 years. And it wasn't until I was diagnosed and I found, the HS Trust's site that's given me a lot more information and made me feel not so alone and isolated.
Yeah,
that's helped tremendously.
Yeah. I've got to ask, I don't mind, maybe go back to Tara. Why is it such an unknown condition? Obviously, I've just been reading, and only around 1% of the UK will have this. But how is it so? where has it come from all of a sudden? Because obviously it's such an unknown condition that I'd never heard of it before.
You would think that it's only just recently come about, but it was actually first diagnosed in 1833 by a French doctor. And the reason why it is so uneducated is because there is just so little information surrounded it. There is still an unknown cause. Nobody knows the exact reason why this happens to people. And the actual progress of HS is different for every single patient. Some patients have a hereditary illness where it can present itself in other family members. Other patients, there isn't any family link, so it's extremely unpredictable. But also because of the way that it manifests itself and patients end up completely withdrawing from society, there's the patients that live in isolation that don't necessarily seek medical advice because they are so embarrassed and they're living a life of complete isolation on their own. But then you have the other patients where they are very severe, so they have to get the intervention. Otherwise, there is no living for them because they don't have that daily life. They don't have any quality of life whatsoever. And because every patient with HS particularly looks well because it's in places where it's not openly visible, then everybody seems to almost get forgotten about that this illness doesn't exist and that it's not there because it's not openly visible unless you are actually seeing somebody on a doctor's table with it.
Yeah. I'm just looking at stats for here, and it's really like awful. 94% of people who have HS feel embarrassed by their condition, that's pretty much everybody.
Yep.
And then I've got 79% feel helpless.
Yep.
And then 72% feel isolated. They are such big numbers.
Yep.
Obviously, it's such a debilitating condition, like you say, because it's one of those ones that can normally be disguised with just a T-shirt or something like that, so people might not even know that their work colleagues or even maybe in some cases their families, because of that huge statistic of being embarrassed, they might not have actually told people. If people are embarrassed or what would you say if someone thinks that they might have developed this or they are developing something that sounds a bit like this? What would you say for them to do?
My advice would be to obviously seek medical help as soon as possible, sooner rather than later because of the length of time for diagnosis, but also education and awareness. That to me is key and priority for any self-management of an individual. They have to make sure that they're aware of what is happening and that, there is no reason to be afraid, no reason to be embarrassed. And you do feel like you are the only one suffering from it because there is nothing in society to sort of help or offer guidance. So it is extremely difficult, but I really would urge anybody to seek help from their doctor. But particularly for a skin disease, I would insist on seeing a dermatologist. That would be where the knowledge would lie with regarding HS.
Yeah, okay. Debbie, can you just, I don't want to scare anyone, but can you tell us if people are wondering if they think, it might be acne, it might be not, what are the things that they should be looking for if they think, what's the difference between acne and HS, what people could look out for?
Well, as we don't have all morning to go through this,
yeah, of course, yeah. If you can...
I would just have to repeat what Tara says, is to initially see your GP and insist, if it comes down to that, on a referral to a specialist medical dermatology center.
Yeah.
Also, it's Tara here. I just would like to interject and say that the one main difference between acne and HS is that acne, the pimples can be quite large, probably the size of a pencil head or something, whereas a HS abscess could go to the size of a golf ball. Okay. And that's just one abscess, whereas when I was at my worst stage, I had 30 in one region. And it can be extremely devastating to somebody's body, and their body image then obviously goes low because of the effects of HS.
Of course. Okay. So that's a huge difference. Sorry, I cut in someone there.
Sorry, can I just say as well how much impact it does have on your daily life?
Yeah, of course. Yeah.
From relationships to having no self-esteem whatsoever, your body image. It's very, very depressing. The pain, every day, I'm in pain with this condition. You have to think about where you're going, how you're going to get there, the clothes that you're wearing. But what I will say is, you don't have to suffer in silence now.
Yeah.
You can get support from the charity. Awareness is getting out there, and this is what this week's all about.
Yeah, brilliant. Well, this week is, like we've mentioned, HS Awareness Week. So we just have a quick little bit of a chat about that. So what are we doing for HS Awareness Week? What is obviously it's from the 6th to the 12th, so what is your week consisting of?
The week is consisting of pushing and raising the profile of HS, trying to reduce the stigma attached to it. So we are increasing awareness through social media, Facebook, Twitter feeds, thunderclap launches, anything where we can actually make a drive to just get the name HS out there, to get interest into it from not just patients but carers of patients and support people and general public and medical professionals across the board, going from primary care to nursing to dermatology to surgery, literally anywhere where there is a pocket for information that needs to be improved and increased. That is what the Awareness Week aims to do. And we also have events that are going on. People are doing sponsored events. Patients are dyeing their hair blue. Today is Wear Blue Day, so everybody can wear blue to increase the impact of HS as well. So everybody can get involved by doing something.
Brilliant. Okay. And can you just let the listeners know, like you mentioned Twitter and Facebook and the website. Can you just give us those bits of information, just so if people do want to just log on and find out more or donate, what can they do?
Absolutely. The main or the best place to go to would be the charity website, which is hstrust.org. There they can find information surrounding the disease itself. They can order publications that the charity produces. They can gain treatment and disease information. But there's also links to support groups. There's links to the charity runs 3 support groups around the UK, so that patients can find their local one to attend and actually go and meet other sufferers. And it's a great place to improve and increase information. And it's not just for patients, it's for medical professionals as well to improve their knowledge.
Brilliant. To sum it up, it just seems to me that it's not just raising awareness of HS for the outside world. I think it sounds as well like the whole, you're not alone. We are in this together, and together we can work at making, obviously when you do have the condition, it sounds hugely debilitating, but it just that kind of, you're not alone.
Absolutely. That's the main message, is that you're not alone. One voice is one voice, but the more we are, the louder.